Hello everyone. Let's go to the discussion topic today. So it's devices used in ICU. So this is a setup. Introduction. To introduce, an intensive care unit comprises not only of patients but also the equipments which plays a vital role. So mainly the equipments used are the respiratory and cardiac support monitor, pain management, emergency resuscitation devices and other life support equipments. So these are mainly designed to care for patients who are seriously injured, those who have a critical or life-threatening illnesses, and those who have undergone a major surgical procedure, thereby those who are requiring a 24 hours keen care and monitoring. Let's see what is the purposes. So this ICU equipments are mainly designed and equipped to provide specialized care to patients with specific condition. Types of devices. Further, the types of devices are classified into three. They are patient monitoring devices, life support and emergency devices, diagnostic devices. Patient monitoring devices or equipments comprises of arterial line, bedside monitor, blood pressure device, that is sphygmomanometer, blood pressure monitor, electrocardiograph, that is either ECG or EKG machine, electroencephalograph, that is EEG machine, intracranial pressure monitor kit, an intracranial pressure monitor. It also includes pulse oximeter and the glucometer. Life support and emergency resuscitation devices comprises of a mechanical ventilator, laryngoscope, airways of different sizes, infusion pump, crash cart, intra-aortic balloon pump, CPAP, that is continuous positive air pressure machine, or it is also called as BiPAP, and a defibrillator. Diagnostic equipments. Diagnostic equipments includes mobile X-ray units, portable clinical laboratory devices, your bronchoscope, colonoscope, endoscope and a gastroscope, which is all available in the bedside itself in that particular ICU. Other ICU equipments includes, these are disposable ICU equipments which can be discarded after every use. They are as follows: urinary catheter, urinary drainage collector, suction catheter, nasogastric tube, that is NG tube, IV line or catheter, it is intravenous line or catheter, feeding tube and the endotracheal tube. So these are the other ICU equipment. Moving on to the hemodynamic monitoring, which is very essential in the ICU. They are blood pressure monitor, that is NIBP or IBP. NIBP is non-invasive blood pressure monitoring and IBP is invasive blood pressure monitoring. So it also comprises of central venous pressure monitoring, pulmonary artery pressure monitoring. So then the mixed venous oxygen monitoring and the cardiac output. So this comprises of a hemodynamic. Why to monitor BP? So there are alterations which is inherent. It provides a clear data for interpretation and to make a very critical therapeutic decision of the particular patient. So it is very essential for determining organ perfusion, that is MAP. MAP is nothing but mean arterial pressure, which is very important except with the heart. Then comes the non-invasive monitoring. Non-invasive monitoring includes blood pressure monitoring, heart rate, mental status of the patient, skin temperature, the capillary refill and the urine output. So let's discuss what is arterial line and why is it used in the ICU setup for a patient. Definition: it is the method of direct continuous monitoring of systemic arterial pressure by inserting a catheter into peripheral artery either in arm or in the leg. So the catheter is connected with a transducer with electrical signals in it. What is the purpose of inserting an arterial line to a patient who is very critical? So this provides a very clear, constant measure of a patient's blood pressure, and this is very essential to stabilize the condition of the patient. This is the ideal purpose, and this gives you a clear picture. In case of open heart surgery, this continuous measurement is very essential. We can know what are the ups and downs which is happening in the patient. Either the blood pressure is high or low. This gives you a clear picture. So then the arterial line also provides access for frequent blood sampling. Whenever you want to withdraw blood, you can also use this. So this is the purpose of arterial line. Moving on to the indications. So the indication comprises of frequent titration of vasoactive drips. That is, for the hemodynamic stability, what drugs we are giving. We can also look into the continuous arterial blood pressure monitoring, and we can titrate the dose or amount of the vasoactive drugs which we are giving to the patient. Next, the major surgery involving the large fluid shifts in the body. CVP, that is central venous pressure, and aortic surgery, unstable blood pressures and frequent ABGs or labs investigations if required, and unable to obtain non-invasive BP. In these cases, we go in for arterial line. What are the common insertion sites? The common insertion sites are radial artery, femoral artery and the brachial artery. What are the articles required to start the arterial line for a patient? You require a sterile gloves, arterial line kit, pressure tubing, 1000 ml normal saline bag and a 1000 ml of normal saline, pressure bag, IV stand or IV pole, arterial line needle, tegaderm dressing, a cable to connect the transducer to the cardiac monitor. So these are the articles which is required for arterial line. Okay, after you start, let's see what would be the complications of securing a arterial line. The complications are hemorrhage, that is bleeding, air emboli, infection, altered skin integrity and impaired circulation. Let's see what is the nurse's role. Never give any medication through an arterial line, hence it's directly into the artery. Always check the pressure of the pressure bag and maintain a pressure of 300 mm of Hg. Cover the cannula cap with adhesive tape. Flush properly the arterial line every hour and every time when you withdraw a sample from the arterial line. So every 4th hourly, calibrate the arterial line. In each shift, you will have to do it once. Always compress the site after removal of the catheter for 10 minutes, as it is a high possibility of gushing of blood through the arterial opening. bedside monitor. So the bedside monitor is a display of body functions on a device that looks like a television screen or a computer monitor. This is a cardiac monitor where you can see the entire details of the patient. So this may include the electrical activity of the heart via an EKG, respiration rate, blood pressure, body temperature, cardiac output, an amount of oxygen and carbon dioxide in the blood. So each patient bed in an ICU has a physiologic monitor that measures these body activities. All the monitors are networked to a central nurses station in a common computer. The bedside monitor has alarms that signals the nurse if a body function needs a quick attention. Moving on to the purposes. So the purposes is mainly or typically used when the doctor wants to measure functions like the heart rate, respiratory rate, blood pressure and temperature. In addition, special functions such as capnography during your intubation is essential, oximetry, electroencephalography and PAC, that is pulmonary artery catheter readings, are also used in a very certain situations. So this is the ideal. But moving on to the nurse's role. So in each shift as a nurse, you are responsible to check properly whether the connections are giving a correct reading. An abnormality in a reading is signaled immediately by an alarm. So if it is so, inform the doctor or the physician immediately. Let's go on and see what is central venous line or central venous catheter. A central venous catheter is a special IV line that is inserted into a large vein in the body. Several veins are used for central venous catheters, which includes your location in the shoulder, that is subclavian vein, around the neck, that is the jugular vein, and in the groin, that is the femoral vein. So this can be inserted mainly in the subclavian vein, that is near or below the shoulder, neck, that is the jugular vein, and groin, that is the femoral vein. So this serves a purpose. This is a subclavian vein where it is just below the shoulder girdle, and here it serves the internal jugular, that is around the neck. So this is the ideal point to insert the catheter. So let's see what are the common sites for central venous catheter insertion. So can you see here the internal jugular, that is 6 cm, subclavian, axillary, that is 13 cm away from the aorta, basilic, that is 24 cm, cephalic vein, that is 38 cm. So this superior vena cava is 7 cm away from this line. So these are the common ideal sites for central venous catheter. Let's see what are the purposes of central venous catheter. The special purposes are, this is mainly designed to use in patients, those who does not have adequate veins in their arms, or those who are in need of more medications to meet their hemodynamic stabilization, or those who require nutrition that cannot be given through small bore arm veins. Second thing, it serves as a guide for fluid balance in critically ill patients. And third, it is to determine the function of the right side of the heart. So these are the purposes of central venous catheter. Let's see what are the complications. Bleeding and infection are the ideal associated complications with IV catheters. Collapse of the lung is the serious complication. If this occurs, a chest tube, that is a thoracostomy tube, may be required to re-expand the lung. Arterial puncture, cardiac puncture may happen when you put in the catheter. Pneumothorax, hemothorax, air emboli, thrombosis, cardiac tamponade, cardiac arrhythmias, and carotid artery puncture. These are the main complications which is associated with central venous catheter. Let's see what is the nurse's role. First thing, monitor for the signs of infections and complications. Assess for the patency of the CVP line. Sterile dressing should be done to prevent infection, and especially CVP care, that is as per the protocol of the hospital. If it is 72 hours, then you will have to change the dressing every 72 hours. The bores and the caps which is used should be cleaned with chlorhexidine as per the protocol of the hospital. Next, the length of the indwelling catheter should be recorded and regularly monitored. You should check either the stitches are being removed or not. Whether the catheter is in situ in each shift, you will have to also check that. These are the nurse's role in handling with CVP line. Next, let's see what is ICP monitor. ICP is nothing but the intracranial pressure. This is commonly seen in neuro care ICU, but sometimes in medical ICU we also have an ICP monitor. So this ICU patients who have sustained head trauma, brain hemorrhage, brain surgery, or conditions in which the brain may swell might require intracranial pressure monitoring. Purposes. The purpose of ICP monitoring is to continuously measure the pressure surrounding the brain. If this pressure gets too high or if it gets too low, then there is a high chance of brain damage. So what happens here, the ICP monitor is inserted by a neurosurgeon while this happens in an ICU or an operating room. He does this with a numbing medicine. The neurosurgeon makes a skin incision and insert the ICP monitor into the brain to a very small hole or bore which is created inside the skull. Next. So the ICP monitor is usually inserted in the left or right top front of the brain. Some ICP monitors can drain spinal fluid if it is required. So this is an ICP monitor. Here the pressure comes in. We can set it. And this is the ICP sensor consumable. This is a transducer kit where you can adjust and connect this to the cardiac monitor. Let's see what is the complication. Potential complication which is associated with ICP monitoring are infection and brain hemorrhage. This is very, very infrequent. Moving on to the nurse's role. So as a nurse, you must be aware about optimizing the cerebral tissue perfusion, preventing infection, maintaining patent airway, maintaining negative fluid balance, prevent infection in the dressing site or in the insertion site. So to summarize, till now we had discussed about the equipments or devices which is used in hemodynamic stability of treating critically ill patients, such as arterial line, bedside monitor, a cardiac monitor, central venous catheter, insertion, and how it is essential in treating patients, those who are in ICU, and ICP monitor. Hope you understood the topic. Thank you.